healthcare in Canada is going to be another place where it's going to become, I don't know, I think it's going to become quite hard, especially as we move. It's another system that's built around the industrial model. And once you get into genetic, like customized individual healthcare models, like where people expect an individual treatment, I don't think our system really knows how to deal with that. Like we're like, no, we know how to do hearts, and we know how to do it in bulk. So we're gonna like get people funneling through. But like, what happens when everybody actually, like, you can actually start offering like very individualized services? I don't think our model knows how to cope with that, and that's going to become a real pressure point. And I think there's some open innovation that's possible there. Like in the U.S., there's a healthcare record management system developed by the military, by the VA, that during Katrina meant that while every civilian's healthcare records got washed away by the storm and destroyed, anybody who was in the military had their records in the cloud, and they could walk into any hospital and they could get downloaded and they could get treatment right away no matter where they were in the country. And the system that powers that, which is called Vista, is all open source. And there's the guy who created it has since left the government of the United States, now has a shop in California where they will do installations of Vista, and it's all open source, so the costs are radically lower. And there's nothing that even stops us from saying, well, actually, we don't like the way Vista is right now, but we could, like, what's called fork it. Like, we could just, let's hire a bunch of developers, take a look at the code, understand it, and then be like, from henceforth, we're going to take it in our own direction to meet Canadian needs. In the county of LA, they started doing what you guys do here, which is they put the restaurant inspection data on the front door of the restaurant. Yeah. So when they started doing that, a bunch of things happened. One is, fewer people went to restaurants that had bad reviews, and more people went to restaurants with good reviews. It's like the best regulatory regime you could ever hope for. It's like people who do well in the inspections make more money. Like, that's a very good reinforcement, much better than I'm going to scold you next time. But the more interesting that happened was, in the year that they started deploying them, there was a 16% decline in the people who ended up in the emergency room due to foodborne related illnesses. Wow. And in the second year, there's an additional 6% decline, and the third year, an additional 3% decline. So probably a cumulative total of roughly about 25% for that particular category of illness. But I'm like, why isn't there an open data schema for restaurant inspection data, so that you can put restaurant inspection data into Yelp and into Google Maps, into Urban Spoon, into everything? Because every time you search for a restaurant, you want to be able to see like the peer reviews, but then you see the restaurant inspection data, and we already know that it shapes behavior. And if you roll that out across North America, like every ER gets 16% in that less in that category, I don't know, there's probably at least $500 million in savings.